Okay, my name's Darren Carr. I'm one of 2 consultant psychiatrists with the team, and I'm also clinical director for the county directorate. As part of the medical team, we obviously offer outpatient appointments for patients, including new assessments. So the doctors particularly will offer diagnostic expertise. So people who might have complex mental health needs that need some clarity, they want to know, perhaps their GP wants to know, and we need to know what their diagnosis is, if that's important to guide their treatment. Medics will also be primarily responsible for prescribing medication for mental health problems and making sure that patients' physical health is prioritised. The team has worked incredibly hard. There have been a lot of challenges over the last few years, not least COVID, but we've also been playing our part in broader transformation as Staffordshire moves to ICB. As part of our transformation, we've received some new roles to the team. So we now have a pharmacist for the first time who is embedded within the team and is going to be working with us to ensure that we prescribe effectively and safely, and that also physical health monitoring is done properly, and that we interface and liaise effectively with GP colleagues. We've had other staff, so we've now got future focus staff. We have some additional community workers. We interface really well with our PCN mental health colleagues, and I think we have an incredibly good relationship with our 2 PCN mental health nurses, and that's helped deepen our relationships with GPs. I think our relationship with GPs in the Moorlands is really strong. You know, we often will visit them face to face. Many of them will WhatsApp me, phone me, and I would hope that GP colleagues would say we offer a really responsive and accessible service. So our staff have been really key in that, and have Eve and Claire doing those roles. We also have our junior doctors who again worked incredibly hard over the last 2 years. We have both higher trainees here and core trainees. We also train GP VTS doctors who are going to become GPs, so giving them a really good experience of mental health. So despite the fact that we've been under a lot of significant challenges, we've done a lot of transformation work. A big part of what we've done over the last year is really embed our clinical pathways, and the Ashcombe Centre is our smallest CMHT, but being small allows us to be quite agile, it allows us to make change at pace, and we have led on the development of a number of our clinical pathways which will now be rolling out across the trust. And the team, I think, have really had an appetite for taking on new roles. So we have an advanced nurse practitioner who's developed our ADHD service, our qualified members of staff, our nurses, our OTs, our social workers, nearly all of them have shown a real enthusiasm for developing new skills. So we used to be very reliant on psychologists to provide our psychological therapies. We've now got our nurses, our OTs, our social workers running a lot of our groups, and that means more patients can benefit from evidence-based treatments without long waits. We want to lead on transformation at the Ashcombe Centre. I think we have a track record of innovation. Being small allows us to do things quickly, and I think the team are not ones to sit on their hands for very long. I think one of the things that's impressed me about working with my colleagues, we've got some older members of staff, we've got some people who've joined us more recently, and all of them have shown an appetite for doing things differently. All of them are very, very patient-centred. I think when you're busy, when you're trying to deliver great patient care on limited resources, sometimes a casualty is your compassion and your kindness. And I think that our staff absolutely embody the trust values, a more caring, more kindly and more patient-centred team. I think it would be hard to imagine. I'm extremely lucky to work with them.
You are watching CTV on Catch Up. Subscribe to stay updated. Here's 2 other videos available on Catch Up.